Hello, my name is Jennifer White, and today I am going to talk to you about the low incidence disability Rett syndrome. Although Rett syndrome is an infrequent disability, it is likely that as a school psychologist you will encounter it in your career. My very first year as a severe and profound special education teacher, I had a student in my class named Haley. Haley was a very sweet girl. She was 8 years old, nonverbal, and in a wheelchair. She was the first person that I had known to be diagnosed with Rett syndrome. Like many with Rett's, she had seemingly typical development until about the age of 2 when she lost her ability to walk, talk, and control her hands. The school had placed her in my classroom, a self-inclusive classroom, that consisted of 3, 4, and 5-year-olds, despite the fact that she was much older than they were. They did this because of her perceived lack of cognitive ability. She wasn't able to communicate what she knew and didn't know, and she did not perform well on the assessments that the school utilized. She had very little use of her hands, and she wrung them often. She also had a habit of very loud teeth grinding. Back then, in 2001, there was very little information regarding Rett's. And I accepted what the school psychologist had told me and provided only learning in regards to daily living skills and sensory experiences. She was not provided any instruction in reading. There was no math concepts taught to her. She sat through circle times with younger kids, reviewing daily schedules and songs, self-grooming activities, never being exposed to academic learning. Now, research tells us that these children can actually be very capable and often have high intelligence and can learn a lot of the academic skills of their peers. I imagine or suspect that Haley's teeth grinding was a result of her inability to communicate how bored she really was in this class and how frustrated it must have been sitting there. So today I'm going to cover all that research has taught us about how to help students like Haley so that other educators do not make the same mistakes that I did. I will cover the background and causes of the disability, criteria for diagnosis, the effects of symptoms, and interventions for support. As you can see, Rett's is a relatively new disability, with the first known cases being reported in the 1950s. Here is Dr. Andreas Rett, who was a pediatric physician in Austria who specialized in neurological disorders. He was observing 2 girls in his waiting room in 1954, and he noticed similarities between their behaviors. He checked their charts along with other patients and found that he had 6 other female patients with the same clinical and developmental profiles. He created a short film about these girls and traveled throughout Europe in an effort to identify other children with potentially the same disability. Dr. Rett published several articles throughout the world describing the syndrome, but it took other researchers to publish before the US took notice. Not long after Rett's had made a connection with his patients, a Swedish doctor, Dr. Hagberg, also noted his own patients with similar profiles. In 1983, the syndrome Rett's became mainstream in the United States when Hagberg published an article in the Annals of Neurology describing Rett's and naming it after Dr. Rett. But perhaps the most significant discovery came in 1999 when a team of researchers discovered that Rett's is caused by a gene mutation on the X chromosome. So now let's talk about what causes Rett syndrome. MECP2 is a protein-binding gene that is located on an X chromosome. The mutation of this gene leads to overexpression of other genes, which is toxic and that is what causes Rett syndrome. So it is a gene disorder and is genetic. This is fatal for boys because they only have one X chromosome. But because girls have a backup X chromosome, they survive. This is why you predominantly see the disability in females. A final piece of noteworthy history happened in the early 2000s. Specialists have also been developing and ingesting ways to classify the phases that those with Rett syndrome seem to go through. Scientists generally describe 4 stages of Rett syndrome determined by ages, although not everyone fits perfectly within these age brackets. Stage 1 is typically described as the early onset or stagnation period. This is a little bit more difficult to identify. One, because the symptoms of the disorder are somewhat vague at this stage. It's difficult for parents and doctors to identify. And the development is slowing, is very, very subtle. Infants at this age may begin to show less eye contact. They may have a reduced interest in toys. There may be delays in gross motor skills, such as sitting or crawling. Hand wringing and decreased head growth may occur, but it's so subtle that it doesn't typically draw attention. This stage usually lasts for a few months, but it can continue for more than a year. Stage 2, from age 1 to 4 years, is known as the rapid destructive stage. This can last for weeks or for months. The onset can be very rapid or it can be gradual as the child loses purposeful hand movement. Breathing can become taxing as the muscles decline. The body does not breathe the way that it should be. The child may hold the hands clasped behind the back or held at the sides with random touching, random grasping and releasing. Movements continue while the child is awake, but often they disappear when in sleep. Some girls also can display autistic-like symptoms, such as the loss of social interaction and communication, and oftentimes this disability is confused with autism because of those characteristics. Walking can be unsteady at this stage and slowly deteriorating, and slowed head growth is usually noticed during stage 2 as well. So stage 3 is a plateau or a pseudo-stationary stage happening between the ages of 2 and 10 years. This stage can last for years. Apraxia, seizures, or apraxia is loss of language, seizures, impairments in the hand, all become very prominent during this stage. However, there can be an improvement in behavior. There is often seen, the girls are often seen to have less irritability, crying, and autistic-like features. A girl in stage 3 may show interest in her surroundings, be more alert, have more attention, and the communication skills may improve. And this is where it becomes distinguishable from autism because those social skills do improve. But it is possible for many girls to remain in this stage for most of their lives. The final stage, or stage 4, is known as the late deterioration stage. Again, it can last for years or even decades. Prominent characteristics of this stage include reduced mobility because of muscle weakness. There can be a curvature of the spine, scoliosis. Their muscles show spasticity, rigidity. They can even have dystonia. But interestingly, the eye contact will remain intact. So let's look now at the diagnostic criteria for Rett syndrome. So aside from gene mutation, those with Rett syndrome must fulfill all main criteria and exclusive criteria. So under main criteria, they must have partial or complete loss of purposeful hand skills. There must be partial or complete loss of spoken language. You must see gait abnormalities, so walking abnormalities, dyspraxic or absent, and stereotypic hand movements. So remember, this is on top of gene abnormality. So exclusion criteria, none of these symptoms must be the cause of traumatic brain injury, because of neurometabolic disease, a severe infection, or very abnormal development in the first 6 months of life. So furthermore, those with Rett's typically show normal pre- and perinatal development and often are reported as having typical development during infancy. Most show regression in skills described under the main criteria after about 6 months, followed by recovery or stabilization. Assessment of Rett syndrome is typically carried out by a doctor through genetic testing from blood tests, and that blood test can determine if a mutation in MECP2 exists. Genetic testing alone is not enough to determine the presence, as some with the genetic mutation don't actually show signs of Rett, as was discussed on the previous slide. Diagnostic criteria has to also be fulfilled. While those working in schools will rarely be involved in assessment for diagnosis, assessing cognitive abilities will be a responsibility of those in schools. And recent research has found that we have been underestimating the ability of those with Rett syndrome because typical assessment measures are not conducive to measuring ability. In a research study in 2012 within the Montefiore medical systems, it was determined that those with Rett's can process and prioritize information beyond what was originally thought of cognitive abilities. Those with Rett's showed to hold steady eye gaze with others and prefer to look into the eyes of others instead of at objects. And that's, again, what separates this disorder from autism. Typically, assessments which require use of purposeful hand movement communication are not sensitive enough to measure ability. Typical assessments which require use of purposeful hand movement communication are not sensitive enough to measure ability. Eye gaze technology, however, allows those to communicate preference, feelings, and to demonstrate their learning. A variety of technology is available now, everything from advanced computer programs to using picture cards or cards with yes and no on them. Rett syndrome affects all aspects of life. Because it is a disorder of the nervous system, it affects all 5 of these areas, from motor skills, daily living skills, social emotional abilities, communication, and cognitive abilities. We will now look at the effect Rett syndrome has on each of these abilities, as well as what we can do as educators to assist those with Rett syndrome. As you can see from this ad from curerett.org, a little girl named Olive is describing what it's like for her to have Rett syndrome. And she clearly indicates the difficulties that this is having on her gross motor abilities. She describes liking to dance, and she loves being on the go, but because she's no longer able to walk, her sister is the one who's having to push her. This is very common for many of those with Rett syndrome. Loss of purposeful use of hands, talking, and often the ability to walk are commonly affected in the area of motor abilities. In some cases, life-sustaining functions such as breathing and swallowing are also lost. Those with Rett's often require wheelchairs for mobility, and as we discussed, use of eye gaze technology in order to communicate. For nutrition, feeding tubes are also needed to be in place to make up for the loss of swallowing. So what can we do to help these students out physically? Because there is such a great variety of ability amongst these students, I highly recommend discussing this with an occupational therapist and physical therapist and considering where the children out before implementing specific goals, accommodations, and modifications in the area of fine motor and gross motor skills. But some basic things to consider, because the majority of those with Rett's lose purposeful hand use, in the area of fine motor, rethink how we are developing hand goals. Do not require activities that simultaneously use hands while demonstrating learning. So for instance, in the area of math, if you're asking the student to demonstrate an understanding of multiplication, don't require them to use cubes in order to do so. So also thinking about how we need to allow access to the curriculum without the use of hands. So in this same type of lesson, if the rest of the class is using manipulatives and blocks, perhaps having charts where the student can pick out the pictures of the cubes that would match the multiplication problem, or doing something with a buddy system so that the student is participating without having to use their hands. Also consider access when we now talk about gross motor abilities. How is the student who is going to be in a wheelchair going to maneuver around the class? Is there enough room for the child to access all the materials in the room? Is there enough time allotted in between activities for a child who's in a wheelchair to get from location to location? So think about providing extra time and extra space for mobility. Also, ensure that proper seating and positioning is taking place. So if you have a child in a classroom where the students are sitting on the floor for circle time, there also needs to be a way for the child with Rett's or any child in a wheelchair to be accessing the curriculum and the conversation and the activities at the same level as their peers, so that everyone's at eye level. So their peers should not be sitting lower than them or towering above them. So now looking at how a child with Rett syndrome is impacted by daily living skills. Most with Rett syndrome are unable to carry out daily living skills without assistance. Dressing oneself, grooming, ambulating, communicating wants and needs, they all require assistance. But as this little girl Sky expresses, the lack of independent daily living is not a reflection of intelligence. So we as educators need to think about what we implement and the types of goals we put in place to assist them with being as independent as possible while respecting their abilities. Most with Rett's are unable to carry out daily living skills without assistance. Dressing oneself, grooming, ambulating, feeding, toileting, and communicating wants and needs all require assistance. But as this little girl Sky expresses, a lack of independence with daily living activities is not a reflection of intelligence. Interventions can be put in place to assist with daily living skills, but perhaps the most important thing before implementing any goals or schedules is to communicate with the families and the therapist. These children will be receiving likely occupational therapy, physical therapy, speech therapy. And so the goals that are put in place in the classroom need to piggyback off of what's happening with the specialist, but also not be so redundant that it's overwhelming. It also needs to be considered what types of daily living skills are being worked on at home or what should be worked on in school. So, for instance, those with Rett's often have very sore jaws. Some grind their teeth from stress, and others just because of their stiffness. Um, it's very difficult for them to brush their teeth. And so, some families want this type of skill to be worked on at school as part of their daily living activities, and others are already working on this at home and would prefer it not to be worked on. But dental hygiene is a very important aspect of daily living skills and something to be considered in these children. So communicate with the family, figure out what is going to be best to be worked on in the school to support short-term goals as well as their long-term prognosis. Also, a communication log is an excellent tool to be used with really anybody who has a severe or moderate learning disability. This allows the teachers and parents to discuss what type of activities are being worked on, what is happening. For instance, feeding. If the child is able to utilize their hands to some degree and they have a goal of feeding themselves, how that's taking place at home and during the school day is really important to communicate between everyone. If a child isn't feeling well, then the school needs to know this so that they're not asking the child to eat when perhaps they have a stomach ache, as one example. Communication logs are always beneficial for keeping record of what is taking place as well, so that you can go back and look at the communication for patterns in case future situations arise. Also, in the area of daily living, it is extremely important to have a consistent routine. These children need to feel safe and comfortable in their environment, and providing a routine that they can rely upon and expect what's happening next will further their sense of comfort. Using picture symbol schedule if the child is not reading, or a regular schedule if the child is able to read, but letting them know what happens so that every day we're working on self-grooming activities at this time, and every day we're working on routine feeding at this time, and at this point we're working on reading. This will help them to interpret their environment. Now we'll look at how this disability affects both the social and emotional aspects of these children's lives. So meet Lily Rose, and her description really hits upon two aspects. First, she describes screaming and shouting. When it comes to social interactions, these children are very limited in their ability to interact with their peers. Because of their difficulty with communication, they're often relying on nonverbal cues or their voice and other methods to connect to peers. So it can be very isolating for a child with Rett syndrome. Also, her second point speaks to the overwhelming anxiety that severely affects girls with Rett's. Those with Rett's are often unable to communicate their frustrations, questions, or any concerns. And so anxiety can present as teeth grinding, hand mouthing, breath holding, hair pulling, crying, or shouting. So creating environments that are safe and lessen anxiety while creating social opportunities is really key. As I mentioned, main thing is that we want to lessen stress and anxiety. So by providing changes in the upcoming schedule, environment, or if staff is going to be out for the day, or if a field trip is going to be taking place, making sure that these children know this ahead of time. We really want to provide direct instruction in modeling about what different emotions are, how they feel, how we communicate them. This can be done through social stories and scenarios to teach stress management. Um, Looking at each individual student differently so that we can know what their individual signs of anxiety are and intervene when taking place. One of my previous students, I knew when the teeth grinding started that she had reached a level of saturation with the curriculum and really needed to be removed from the environment and allowed some time to just chill out and relax before going back in to learn some more. Um, so be aware of and seek out what calming techniques work for each individual child. There has been a lot of studies to show that music therapy is quite successful. Sensory type therapies, something soft. Some students respond to having something weighted on their lap. Some students do well to have a stuffed animal or a token or something that is soft that they can feel or something that they can squeeze. Really working with their therapists and their families to implement different types of techniques to support these students is key. And make sure that we have implemented a way for the students to request their calming techniques, whether it be through eye gaze, some type of picture symbol, or a talking button that they can hit when they're requesting this item. That is really key. Also, make sure that when speaking or talking directly to these students that you are at eye level. This will lessen the feeling of being overwhelmed by those above them. Now that we've discussed social emotional, let's look at a really critical area that is impacted, and that is communication. Caroline is a little girl from a bilingual family and also has Rett syndrome. And she demonstrates that the area of communication is really impacted in the area of expression due to muscle difficulties. She is not impacted in the area of receptive language. So she can understand what people are saying to her. She's just not able to express her own thoughts and ideas. So what can we do to help these students? So, as we've discussed previously, their eyes are usually the best form of communication. So, some type of eye gaze technology is usually best. Now, not everyone has had eye gaze technology training, nor is that always available. So, looking at students' facial expressions can often tell you quite a bit about how somebody is feeling or what they are needing. You can also use switches. They're battery operated circles that a child can hit with their hand to communicate a message. So usually having a switch that says yes or no or something specific like help on it is helpful. There are also more complicated types of picture boards and voice technology to assist with communication, using yes or no cards, or having pictures or words to represent major activities in time can be helpful. Whatever type of intervention is going to be used, it is important to start that early on. As soon as a child is in school, communication skills should really start being developed. There is no prerequisite to starting eye gaze training, and research is showing that the earlier it is started, the more successful it is. Also, implement a robust vocabulary. While they're learning to use eye gaze training, It does not, they may need more basic words, but it does not mean that they can't be inundated with more complicated vocabulary terms when being spoken to. Um, Oftentimes, people are speaking down to these children, speaking very loudly, speaking very slowly, unless there has been some sort of cognitive assessments that were done accurately to determine that the child is struggling in this manner. None of those things are necessary. These children can understand what is taking place and what is being communicated to them. Also, make sure that the communication interventions being used are implemented across all environments. It doesn't do them very good to use picture symbols at school and voice activation at home. It really should be consistent across all boards. Make sure that they are getting intensive, aided, and ongoing support. Um, Once you've introduced a communication aid, it will need to be supported for years to come. Their abilities, their needs will constantly be changing and requiring consistent ongoing support. So now let's look at our final area impacted, and that's in cognitive ability. So this is Audrey. She's a whiz with numbers. That is a huge takeaway. She has the cognitive ability to be really successful with numbers. These children can read. These children can do math. And these children can learn many of the things that their peers can learn if we provide them with the appropriate accommodations, appropriate modifications, and we evaluate their learning needs appropriately. So do not assume that because a student cannot tell you what they have learned, that they did not learn it. Consider not only alternative cognitive assessments, but alternative ways of measuring these children's progress. Guaranteed, you may be frustrated by their inability to respond, but is much more frustrating for them. They tend to have inconsistent responses. Sometimes they may seem to know something and sometimes they may not. This comes from a difficulty with expression and not necessarily a difficulty with understanding. Allow the children access to instruction in core academics. As mentioned previously, these girls can read. Introducing them to letter sound correspondences, decoding skills early on is huge. Make sure that when you are teaching that they are provided with ample time to demonstrate this learning. They may not be able to provide you with the answer there, so you'll come back to that question again and have them demonstrate that learning later. Oftentimes, it seems as if there is a motivation or cooperation issue with children with Rett's, and the amount of energy it required to participate and learn is not equal to that of their peers. So having something, breaking up work into small amounts, into small manageable tasks, and having something that is motivational, such as music therapy, has been shown to be very successful. Also, as mentioned previously, speak to those with Rett syndrome the same way that you would speak to a same-aged peer. As some of these girls have expressed, they're not stupid, they're not incapable. We just have to find the right ways to support their learning and the right ways to have them demonstrate their learning and communicate their abilities. So, a person who is severely impaired never knows their hidden sources of strength until they are treated like a normal human being and encouraged to shape their own life. Let's take what we've learned about Rett syndrome and help our students grow and achieve all that they're able to, and not be hindered by their difficulties and struggles with Rett syndrome. Thank you for your time today. If you have any questions or would like sources for the information presented, please do not hesitate to contact me. I appreciate your time.